Hi, everyone. I'm Kathleen Wallace. I'm an audiologist based in New York City and the head of provider education here at Tuned. I am joined by Heather Malyuk, our head of audiology here at Tuned, and we are very pleased to welcome our guest of honor today, Dr. Nina Kraus. If you don't know who Nina is, you definitely want to stick around because she has the innate ability to explain very complex topics as they relate to hearing and the brain and your sound mind in a way that is very digestible and understandable for people of all different knowledge levels. Even me as an audiologist, the way I read the book still has quite a bit of notes, so everyone can get something out of it. We'll be focusing primarily on her book today. Dr. Nina Kraus is a Hugh Knowles Professor of Neurobiology, Communication Sciences, and Otolaryngology at Northwestern University. She has over 30 years of experience studying the intersection of hearing, communication, and the brain, and she oversees Brainvolts, which is the Auditory Neuroscience Lab that really creates some groundbreaking research in music, concussions, bilingualism, reading, listening and noise, aging, autism, neuroeducation, and assistive listening technologies, to name just a few. So, Nina, very happy to have you with us today.
Oh, I'm so glad that you invited me to speak with you, and I'm really so glad that that Tuned exists, because this is a real social need, and it is, because the hearing brain is vast, and the sound mind consists of the hearing brain and our experience with hearing the sounds of our lives. And, Kathleen, you introduced me by saying we do work on concussion, on music, on hearing loss, aging, development, auditory processing, language. And, if you go to the homepage of our website, which I really encourage anyone listening to do, that website is a labor of love. And it's called Brainvolts, and www.brainvolts.northwestern.edu, and you will see that we have panels that illustrate all of these different topics that we research, and you might wonder, what are they doing at Brainvolts? And it's all under the umbrella of sound and the brain. And so sound and the brain is huge. It is just huge. And it encompasses so many things that we care about, and primarily that have to do with our ability to communicate with ourselves, with each others, with our loved ones, with the world around us.
Which is a great segue into our first question here, which is really how sound does connect us to the world. So you mentioned a few things: connects us to other people. How else do you imagine sound's role in the world for people?
Yeah. Well, when I think, my book is called Of Sound Mind. And when I think of the sound mind, the hearing brain is so much vaster. The hearing brain is vast, and it's so much bigger than most people realize. And that is because, so I'm a biologist, and biologically, the hearing brain it engages not just our ears, and the classic auditory pathway of ear to brain. It engages how we feel, so our emotional system. It engages how we think, so what we know, that includes our memory, our attention. It engages how we move. Sound itself is motion. And it engages how we coordinate hearing with our other senses. So one way of saying that is that the hearing brain is vast. It engages how we think, feel, move, and combine our senses. The more formal way of saying that is that the hearing brain engages our cognitive, sensory, motor, and reward pathways. So this is a huge infrastructure. And if you think about it, um, this is what we use to engage with the world because we have emotions, we feel about, we have feelings, and we have perceptions that we need to combine. And, we bring what we know and what we care about to hearing. And so hearing really connects us to the world. And I think if there is, one of the clearest things that I can say, and that really relates to your question, is that sound connects us.
Mhm.
And in this, sound connects us. This is important all the time, but it's especially important today where people are feeling increasingly alienated, where we are divided as a nation, where people are isolated and depressed and stressed. Sound can really connect us. Noise can disconnect us.
Mhm.
Um, but importantly, sound connects us. And in the same way as, we're having this conversation right now, it is this back and forth, this reverberating process that no other sense does for us. And so we can have conversations and we can sing harmony. That is just such a wonderful way in which sound can connect us. We
Mhm.
can listen to the world around us and talk to our kids, read to our kids. That all
Mhm.
involves sound.
Yeah, and that's like such a big part about, what we do as audiologists that always comes up, right, Heather, where we're talking to really try to give significance to why hearing matters, why hearing loss is really something that needs to be addressed, is that really perhaps the biggest ramification is the ability to connect and communicate with other people, the quality of life
Mhm.
ramifications.
Yeah,
Um,
I always talk about the auditory system being a beautiful tool that should be used to its most vast ability with patients, whether it's hearing conservation or looking at amplification. And I think one of the things that the general population starts to get when they speak to an audiologist is sort of not just the magic of this system, but like Nina was saying, how it really connects them to the world. I would say I think a lot of people don't think about it and they almost take it for granted. And the other thing is they don't realize what family members or friends or coworkers might be dealing with their hearing and how it might be affecting them, this whole web of auditory systems that we live in.
Absolutely. It's vast. And in terms of recognizing, especially, I think increasingly we live in a visually biased world. And and hearing is often just not recognized, as you said. Sound is invisible.
Mhm.
And as as an audiologist, sound is a very rich signal that consists, first of all, it's invisible, and the fact that it has all of these ingredients like pitch and timing and timbre and phase and loudness, all of these ingredients that you have to think about when you're thinking about hearing anytime, and certainly hearing through a device.
Yeah.
Um, this is just not common knowledge. And so I think, you and I are aligned in our missions. I was really hoping to write a book that anyone, no matter what background they have, how much or little they know about the topic, can get something out of the book and can begin to recognize. And what has surprised me is the correspondence I've had with people who have written to me and have said, I had no idea. I had no idea sound was so important. And that really is, I think, what we all here on this talk right now are really interested in doing and helping this awareness become more second nature to everyone.
Mhm. And you mentioned that it's important, but also that sound is extremely complicated. So, since you brought up the vision system and how visually dominated we are, um, can you just explain to everyone how the auditory system differs from the visual system as far as complexity, and that a big part of it, the complexity of the auditory hearing system mirrors the complexity of auditory signals or sounds, just how complicated sound is. Can you talk a little bit about that?
Absolutely. So, if you take any visual object, um, it has a texture, a size, a shape, color, a weight. All of these ingredients in a visual object are very obvious, they're apparent. As I said before, sound is invisible and the ingredients are also invisible. And yet processing these ingredients is what the brain has to do to make sense of sound. And our hearing system is the temporal specialist in the brain because sound waves happen very fast. They, and they're there and then they're gone. I mean, as I'm talking to you, what I have just said is it's gone, but your brain has to make sense of this very quickly occurring information with neural timing. And this neural timing is much faster, much more precise than it needs to be for vision, because for vision, you have an object that is static, or if it's moving at a pace that is much slower than any sound signal. And we can measure, sound processing in the brain and get a sense of how good a job the brain does processing these different ingredients.
Hmm. Yeah, and when you look at the anatomy, right, of the hearing system, I think it would surprise people that I'm just going to do a real quick count here, but it's going through at least 10 structures, right, in order to get up to the auditory cortex at a minimum, right? So, and that happens so quickly. And in the book, you mentioned that the difference between bill and pill is a fraction of a second, and that's how specific our brain is at interpreting a signal. And I don't think people understand that hearing happens in the brain, first of all, but just how precise it is, not only with our understanding of speech, but also how we figure out where sounds are coming from. It's just an amazingly acute mechanism that we have.
Yes, and it really does involve hearing the signal and then engaging our cognitive sensory motor and reward systems, and then you have this experience. If you'd like to put a link up to a very short article I wrote about the beams hypothesis, it's in hearing research, and it really just encapsulates the idea that hearing sound has to go from the ear to brain. And as we engage with sound, so the B in beams stands for brain. The E stands for the efferent pathway, which is all of the many, many pathways, way more than 10, that inform the ear about how you are thinking about sound, the context of sound, your experience with sound, your memory with sound. And so the ear has to listen to the brain. So you have the brain, the efferent system, and over time, certain things become very automatic and then automatically go from ear to brain, which is the afferent system. And so, for example, the sound of your loved one's voice is something that you learn is a voice of consequence. And you learn to listen to it, and your brain automatically responds to it, such that when you're asleep, if someone says the sound of your name, your brain is going to respond to that through the afferent pathway because of all the sound to meaning connections you've made. And then the M stands for memory, and S for sound, so beams. And our memory for sound, this is how they are formed biologically, and our memories are what make us us. And sound and memory are deeply intertwined.
Yeah, so going off of that, so the emotional connection to sound that you have, and you mentioned that, a loved one, and the two-way communication with between the ear and the brain probably also surprises people, that they would never think that there's this efferent or, downstream function as well. But usually people can relate to the fact that that music moves them, that sound moves them, provokes emotion. So what is it exactly is happening there?
Ha. Well, so, I said the hearing brain is vast and that
Yeah.
it engages our cognitive, sensory, motor, and reward systems. Well, music is the jackpot, because music really engages what we know, what we remember, what we pay attention to. It really engages our interaction with our other senses. It engages how we move. It's created by movement, and how we feel our emotions. So, to me, music is the quintessential example of what our vast hearing brain is made to respond to. And which is also why making music is so important for developing our sound mind.
I think of being a musician my whole life, and I think of friends I have where we have spent more time playing music together than we have talking to each other, and it's a form of how we communicate. But I have a question that I'm going to ask on behalf of what I am assuming some people might wonder about. Are certain languages, so say I speak English, if I listen to a different language that I don't speak, so say, French or Italian or Norwegian or what have you, does my brain still perceive that as a speech signal, or does it turn into some type of other signal more akin to music?
That's a great question. And, the answer, of course, is complicated. And I would say yes and no. If you don't know the language at all, you really pick up on the melodic parts of language. So, everyone recognizes that rhythm is a part of music, but people don't often realize that rhythm is so much a part of language. Rhythm is so much a part of language. This rhythm. And so if you're not understanding the words, you're still picking up on the rhythm.
Mm-hmm.
So yeah, I think you can think of it as um, as turning it into a form of music.
So cool.
And another part of not only the rhythm, but you can actually also, however, all the inflections or how someone is saying something. You could say the same thing, right? And you can pick up a lot based off of how it's said. So have you found anything in your research with neurodivergent populations, or why, those little nuances can get lost in some people?
Yes, absolutely. Yeah, because you can say the same words, a blue jay, which is a bird, or a blue jay, which is a letter, and it matters how you say it. And as I mentioned, rhythm is a part of all of language. So often in, say, kids who have a language problem. Language and rhythm are very, very, very tied. So kids with all kinds of language disorders can have difficulty with rhythm processing in the brain. One of the things that we have learned is if you look at children on the autism spectrum, many children have difficulty understanding how you mean it. So they will understand the words. So they will understand blue and J, but they will have a harder time understanding, are you asking a question? Are you making a statement? Are you angry? And a lot of this is carried by pitch changes, the pitch tracking, the rhythms of speech that we can measure. So one of the things that we can do at Brainvolts, and that I'm hoping more and more audiologists will incorporate in their practice, because this is something that really audiologists can do best. It can really strengthen the armamentarium that every audiologist can have. But as I'm talking to you now, the neurons in your brain that respond to sound are producing electricity. And we can just deliver sound to a person either through earbuds, or if they're wearing a hearing aid, through sound field. And we can measure the brain's response to sound, and we can look at all of the different ingredients. And we do this using a method called the FFR, the frequency following response, which has been around for decades, but has only more recently been honed into the very precise measure that it now is for a complex signal like speech. And what we have learned is that some children on the autism spectrum just simply do not process the pitch trajectories. So if I'm asking a question, the pitch of my voice will go up. Did you see that? Or if I'm making a statement, the pitch will fall. And we can see that some children on the autism spectrum just aren't processing those microsecond by microsecond changes in pitch that a typically developing child will process very well when, certainly the difference between a question and a statement, just rising and falling. And those very simple pitch tracking trajectories can be just not processed efficiently in some children on the autism spectrum. So having this information, if somebody comes to you with some kind of auditory processing disorder, whether it is through autism or a reading disorder or a language development disorder or an auditory processing disorder, it is really important to be able to measure sound processing in the brain, measure the processing of all of these different ingredients, and get a sense of where are the strengths and where are the bottlenecks. We see bottlenecks especially in the processing of the harmonics and in the processing of timing, the processing of FM sweeps, which link a consonant to a vowel. These sound ingredients are often diminished, the processing of these sound disorders in kids with language disorders, auditory processing disorders. And I think it's very helpful for a family to know, for example, this child is not just not paying attention, or that he is having trouble in school. I mean, of course you're going to have trouble in school if your brain is not processing the sound ingredients that are essential for understanding what is going on in a classroom. So to be able to measure these things and to be able to say, okay, now I do understand biologically what is going on. And of course, the wonderful thing about the hearing brain is that it is malleable. And so, for example, a study we did with assistive listening devices, we did some work in children who had difficulty reading, real smart kids who went to the Hyde Park Day Center, which is a school in the Chicago area. And half of the idea with going to these schools is that the kids get a lot of specific targeted help with reading and with listening, and that the idea is to then bring them eventually back to the mainstream education. And in some of these kids, we had them wear an assistive listening device. So it was called the EduLink at that time. It was something that Phonak made. And the teacher just wore a microphone, and the kid had a little earring thing in his ear that piped in the teacher's voice just directly into his ears. It didn't amplify the voice, it just brought it close by, and it helped them and figure out, oh, this is the sound I should be listening to. I have the teacher's voice in my ear. I'm not going to be as distracted by other sounds that are going on. I can really pay attention better to what is going on. And so what we did is we measured these children's frequency following responses at the beginning of the academic year. And we found that many of the kids had very unstable responses to sound, very inconsistent responses to sound. And how's a child to learn if every time you say Lucy, they are hearing it differently? So they had could see this biologically, that their responses from trial to trial were jittered. And then half of the kids wore this assistive listening device in the same classroom, other kids did not. And then at the end of the year, we tested the kids. Always we tested the kids without the device. So at the end of the year, we've tested the kids, and the kids who had very jittered responses, they were the ones who improved, first of all, most in their reading and language skills. And biologically, their responses now became more stable. They became more stable. So you don't have to wear this device your whole life. Once you can train, auditory training works. Once you train the brain to hear certain sounds, it will automatically, through this Beams hypothesis, it will reach the afferent pathway such that you will always hear the timing differences between bill and pill.
Mm-hmm. It's interesting. Something that I'm taking from what you're saying, I don't really work with kids. I've never worked with pediatric populations that much. But now, as I'm about to become a mother myself, I'm thinking about certain things with the auditory system, certain behaviors in children, et cetera. And I wonder if there's a mother listening and she has a child who has been diagnosed with something like ADHD, that perhaps an auditory processing assessment would be a good idea, or looking into training in that regard. That, I guess my question for you would be, I'm assuming there's some crossover there. Based on what you just said about paying attention to listening, that auditory processing disorder, because it's a bit of a spectrum, and ADHD, that perhaps there's some crossover there.
Well, there is crossover simply because of this notion of our hearing brain is vast, and our hearing brain engages our cognitive, sensory, motor, and reward systems. Mm-hmm. Cognitive consists of what we know, what we pay attention to, and what we remember. So attention, you're right. Attention is a big part of the hearing brain. And so you're going to have a very difficult time paying attention if your brain is not processing the ingredients in a robust manner. So, yes, there is this tremendous back and forth between hearing and attention and scholastic achievement.
And you mentioned how beneficial the microphone system was for students and the lasting impact, which I think is amazing for people, that the auditory training just for a short bit of time can make a permanent difference. And a concept that I find comes up all the time when I'm talking with people about hearing is signal to noise ratio. And that is sort of the golden formula that you have to master to hear well. Signal to noise ratio, for those listening, if they don't know, signal being what you want to hear, noise being what you don't want to hear. The signal needs to be louder than the noise, is the really gross overview of it. So noise, with the FM system, you're cutting out noise, you're giving direct input, and noise certainly has ramifications with the auditory processing disorders and complicating the processing of the sound. But noise in general is also quite detrimental. And even not just the super loud noises, like how we think of what's regulated by OSHA with the factory workers and construction, that it goes far beyond that. And you've actually found that even moderate noise exposure can be very detrimental as well. Is that correct?
That's absolutely correct. And it's not just me. There's resounding evidence from all over the world that moderate level noise, so what I define noise as unwanted sound. And but moderate level noise can really disrupt the hearing brain. And I think that everyone knows, and I think largely it has been through education that audiologists have brought to the people, that everyone knows that loud sounds can damage your ear. Moderate level sounds can really disrupt the hearing brain. And so, think about this. How often have you been in the kitchen and your refrigerator cycles off, or there's a truck outside your window and he cuts the ignition? Now, you hadn't even known, you hadn't even paid attention, you hadn't even realized that this sound was going on in the background. But when it turns off, when it cycles off, your reaction often is, whew. And I do believe that a lot of our current feeling of stress comes from this constant barrage of noise that's not going to give us a hearing loss, but it is definitely going to impair the way that we connect with each other and the world. And our world is noisy. We can't change the world, but we can make changes in our daily lives. We can make educational changes. We can make changes for everyone, and certainly for people who are hearing impaired. But in a classroom, decisions could be made to get the quieter air conditioner or heating system. That actually really matters. Again, biologically, we are made to pay attention to sound as it's our alarm sense, right? And so sound evolutionarily, for every organism, informs us of something that we can eat us, we can mate with. These are important things, and they are inherently a part of us. So if we live in a world where we're constantly being interrupted and alarmed by a notification on our phone, by a beeping truck, by all of the sounds in our lives, and of course this gets in the way of our ability to think, our ability to focus, and there are many things that we can do. You can turn that alarm off your dryer. You can, my neighbor does not have to know every time I lock my car door. You can just turn that off. I think that in airports, which are inherently noisy places, and you can't do much about much of the noise, but is it necessary every time a boarding pass is scanned to hear beep, beep? I mean, the poor people who have to listen hundreds and hundreds and hundreds of thousands of times to this beep. I mean, they could just have a light flash, or even if there was a sound, it could be a little, and we can do things to change our world. I mean, and I mean, music of all things. I mean, I love music. You're a musician, Heather, and yet how many times do you find yourself tuning out? I mean, at an airport again, you're tuning out this music that low-level sounds are really robbing us of our ability to think, our ability to have sound minds. And this is rooted in sound. And I think we have a job. We have a job to do to make people aware of the power of sound, for better and for worse.
Mm-hmm.
Oh, sorry, Kathleen. I was going to say it's fascinating. In the past, I've been practicing almost 11 years now. And in the past handful, I have been seeing more and more patients who are asking for advice on types of earplugs or earmuffs to wear on their daily commute, or, wherever they are, because they say they are so on edge. They feel like they have anxiety and stress because of all the sound they're exposed to. Like you said, even though their hearing is not technically at risk, from what we know, they're exhausted.
Yes. And so in my book, I have a whole big long chapter on noise, and on some suggestions that I have, and I think it's very, very important for people to, like, if you're in a subway, to use. I mean, I prefer just a passive earplug,
Mm-hmm.
and that will attenuate some of the screeching sound. So again, there are things that we can do to, there was a lot of construction going on right out my window for a couple of years at Northwestern, and so I just put earplugs in, and it really helped. So there are things that we can do, and also I think you're about to have a baby. You've just recently had a baby. People are increasingly using white noise machines. Bad idea, in my view, and from a biological standpoint, because there have been really good experiments in animal models showing that moderate level meaningless sounds will disrupt the development of the exquisitely tuned hearing brain. And because babies especially are so good at making sound to meaning connections, they learn languages so beautifully, and all the sounds around them. If a child is trying to make sound to meaning connections to a sound that has no meaning, that's not very good for the hearing
And I
brain,
think that
in my
would
opinion.
shock people. People think that white noise machines are good for babies. And I've never understood how people, when they're studying or they're doing work, how they listen to music, how they have white noise machine, they need to have some sort of noise in the background. I found for myself, I need silence to focus. And it's surprising that not a lot of people value silence.
I'm a music listener when I work.
I
I'm the
can't do it.
opposite.
I can't do it.
I can't have it with English words, maybe in another language if there's words, but it helps me focus.
Yeah.
Interesting.
But I think what is important, and this is again a very big theme of my book, is that, and as audiologists, you know this way better than I do or anyone, is that we are all different.
Mhm.
And so our lives and sound are different. And it of course, there are going to be people who prefer different kinds of soundscapes when they're trying to focus, and that has to do with their lives in sound and what they have learned. And I think this is very important to know, and is something from a biological perspective that I can see really well. So, for example, if I record your brain's response to A Hard Day's Night, and so each one of you, so I've got Kathleen and I've got Heather and I've got my response to A Hard Day's Night. We're able to measure sound processing with such precision that we can also sonify the response. We can, it's an electrical response, and we can play it back and actually listen to the brain, which I have found to be very, very helpful. And what I find is in 3 typically hearing people, in everyone, the sound that you play back is recognizable as A Hard Day's Night, but it sounds different for every single person, and it is really quite different. And I like the analogy of a nose. We all have noses, but they all look different in many ways. And so we all recognize them as noses, but they're different. And certainly our hearing brain is very different, which is why you have such a job, and why I'm so glad that there is that Tuned exists, because you don't fit hearing aids, you fit people. And each person is different. And also each person's sound mind changes as they learn to hear with their hearing aid. And this is something that, to me, the ideal model of what a hearing health practitioner should be doing is being like a personal trainer. Somebody who you really develop a relationship with over time. This is not something that healthcare in general is friendly to these days. It used to be that you had a doctor and you would see the same doctor again and again. It is so important in healthcare too, to be looking at a person over time. And now, we live in a world where increasingly you go to a doctor and you see this doctor or that doctor, and healthcare providers are interchangeable, audiologists are interchangeable, patients, professors are interchangeable. We're just commodities. And yet, I'm just such, and biologically, we are individuals, and dealing with the individual person, certainly for something like healthcare, and you're still in a position where you are doing this. This is really important. This is so important, and it is so. There are very few places where one can find this kind of hearing healthcare.
I agree. I just want to pivot for a minute to with the sound mind and the focus on the brain. Another thing that comes to mind that would impact the brain's ability to process sound is head trauma, concussions. And this is something that's been coming up, quite a bit. Heather, I know, has seen a few people recently with post-concussive symptoms. How does that alter the brain? And I know you're doing some research with Northwestern athletes, where concussions are happening all the time. I've had concussions as an athlete, and we don't really think about the long-term effects on our very complicated and delicate auditory system.
Yeah, thank you for that question. Well, making sense of sound is one of the hardest jobs we ask our brain to do. So if you get hit in the head, it is going to often disrupt this very, very fine tuned, intricate processing of sound. And so what we have learned is, well, I mean, first of all, we have learned from a number of studies that people who have sustained a concussion have difficulty hearing a noise often afterwards. And athletes, young athletes are really, we've known a lot of this by studying our veterans who have had concussive trauma. In older people, especially people who have been our fighters, they also often have a hearing loss, which will complicate the assessment, but it's all part of the whole picture. But for us to be able to look at young, healthy athletes has really, so their audiograms are completely normal. And we have an NIH grant now that we're following our Division I, so our Big Ten athletes at Northwestern over 5 years. This is 500 athletes, males and females, all different sports. And we test sound processing in the brain, again, by presenting speech sounds and scalp electrodes. And by the way, the athletes love this 15-minute test where they just get to lie in a comfy chair. And they work so hard. They're so dedicated to their sport. And if they have 15, they can sleep, doesn't matter. We're measuring what their sound mind has become based on their experience. And we measure their responses at the beginning of the season and at the end of the season. And if someone sustains a concussion, we measure their sound processing immediately after they've sustained the concussion, and then at weekly intervals for many weeks after they've been cleared to play. And what we've certainly been able to see is that being hit in the head, a concussion really does disrupt the hearing brain. It especially disrupts the processing of the fundamental frequency, which is important for, like each one of our voices is centered around a particular fundamental frequency. So it's very important for pulling out signals and noise. I mean, we can see this is a very important ingredient for that. And then there are other problems that we can see. But I think that it is good that you are increasingly seeing people who have had a concussion in your practice, because again, this, Kathleen, you have a big job here with education. And you need to go to sports medicine conferences. If you go to a sports medicine conference, still 98% of the work being talked about is vision and balance. And the hearing system is only a little bit, it's beginning now to be recognized. And I can't tell you, especially when I've had NPR interviews about this, and people will write to me and say, oh, I had a concussion several months ago, and I still have difficulty hearing a noise, or I'm very hypersensitive to sound. Mm-hmm. And, could the concussion, thank you for letting me know that my concussion is a part of what I am experiencing. And I write back to people saying, you're not alone. There's so many people who, in fact, are experiencing auditory themed symptoms mm-hmm. after a concussion. Most concussions, fortunately, resolve within a week, but there is post-concussion syndrome, which can go on for weeks, sometimes years after a concussion. And again, people do, healthcare providers will focus on the balance, on, the vision, various aspects of their care, but very little in terms of the hearing healthcare. And so I think that this is now a more and more important job for audiologists to address and for people, for the public, for the general public to know. The other thing that our athlete work has shown is that, we have these elite athletes, and it turns out, not surprisingly, that being an athlete is really good for the hearing brain. So, we see that if you don't have a concussion, that in general, athlete brains can process some of the sound ingredients extremely well, because they also, they're in a very rich and complex soundscape that they need to make sense of, and they are healthy, and your body and your mind are, of course, integral. And they also seem to have uncommonly quiet brains. Our brains, our neurons are always on, they're always firing, and a certain amount of neural noise or neural firing is important. But where we see excessive neural noise is in children who live in poverty, children who have been linguistically language deprived, who just have not had a lot of stimulation in terms of their language growth and development. We see with aging sometimes an increase in neural noise. So, if you have this neural, think of it as static in the brain, and then, your brain has to make sense of the environmental stimuli that are coming in. Well, musicians have this palate that is uncommonly quiet, which makes them very able to process sound efficiently.
I have a follow-up question about concussion, because this is somewhat new to me, and I'll make this question quick. While recognizing that everyone's an individual, is there a pattern of concussion, and then how long it might take for symptoms to be recognized by the person? And I ask because I have seen 3 people in the past couple of weeks who have had concussion, and of those 3, one knew immediately that something had changed with his hearing. The other 2, it took them a couple years to realize, that things were different. None of them were musicians, nothing like that. And I'm curious, is it the severity of the concussion? Is it truly that auditory systems are so unique that everyone's going to experience differently? What's your take on that based on your research?
Well, concussion is it's a hidden injury. It hardly ever shows up on imaging, and the way that we can see. I mean, if I were able, or our group at Brainvolts, if we had measured your patients' sound processing right after they had the concussion and sort of followed them over time, we could, I'm sure, tell by the sound processing in their brain how things are developing. But concussion, even separate from being an individual person, concussions are so different. Some people get hit here, some people get hit in another part of their anatomy. And the hit can be hard, it can be not so hard. So all of these factors can contribute. And I think it's important for an audiologist and for the general public to know that there is really no hard and fast progression of and it very well may be that the people who didn't realize that they were having hearing problems early on was because they had other problems that was, that they were focusing on. And it was only after those other things cleared up. And so if you were able to measure frequency following responses you would be able to see, oh, I can see that the strength of your fundamental frequency is lower than what one might expect for your age and sex, and give people that kind of additional feedback and guidance. I do think so. One of the ways that I'm hoping, if we can get sufficient funding to branch out into this area of rhythm and concussion, it is my view that rhythm can be used therapeutically as a way to address concussion habilitation. And I'll always say there is no substitute for making music. So that is something that one always would have to do. But if you've just had a head injury, you're not going to be in the best position to be learning a musical instrument. So what we have been doing some research on, and that we have some evidence for, and other people have also evidence for, is a digital music medicine. Interactive metronome is a platform that is really boring. It's not a game. It's not a video game. It is. It's like leg lifts. And the idea, but it's very. It's a course of treatment, and it is we already can see that people's ability to perform on a rhythm task like interactive metronome is diminished after they've had a concussion. And it is my view, and I would love to really be able to do a thorough study to actually to test, to see whether interactive metronome, people have reported that this in fact can be helpful for concussion. And I would like to see not only how people's symptoms change in terms of being able to hear a noise, but also how the underlying biology, the brain rhythms change with rhythmic therapy.
Mm-hmm. Nina, this has all been fascinating for me and Heather, both as, within the circle and within the know of having a deep understanding and appreciation for our auditory system. And I hope for people that don't have as much of an understanding that this has been incredibly insightful and has piqued their curiosity and made them value their hearing a little bit more and appreciate just how much happens to be able to detect even the smallest sound. So I'm going to take a stab at summarizing some of your key points here just for a few action items. But the fact that that sports and a healthy lifestyle can quiet the brain is fascinating. That being a musician is so incredibly beneficial. We didn't get to it, but that being bilingual can also have major effects. And that from an audiologist perspective, auditory training works. You can really train the brain to hear better and to process sounds better. And I love the concept of music medicine. So thank you very, very much for joining us today. This was a real pleasure for me, and I'm sure Heather as well. So we really appreciate it.
My great pleasure. And again, thank you so much for your just taking on the improvement of hearing health care in our world. It is so needed. Thank you.